Hey, Miss Leonard.
Good morning.
How are you feeling?
Not too bad. A little pain, but not too bad.
Good. My name is Gina. I'm one of the occupational therapists here at the hospital. I'm not sure if you're familiar with what occupational therapy is.
Not really.
Okay, so what we focus on is what we call ADLs, or activities of daily living. And that includes things like bathing, grooming, dressing, getting into the bathroom, really all that simple stuff and routine stuff that you were able to do before your hip replacement surgery. But you'll find after the hip replacement surgery, things are a little bit different, but only temporary, of course. So we're gonna go through that kind of stuff and see how you do sitting at the side of the bed, and then we'll get a feel for what you might need help with.
Okay.
Now there's certain restrictions that the doctors don't want you to do and certain movements they don't want you to make, okay? One of them is crossing your legs, which is why this pillow's here.
Oh, okay. I was wondering about that.
Yeah, so we'll take that out. I mentioned before, the doctors don't want you to bend forward to touch your toes after the hip replacement surgery. So if you think about it, that creates a bit of an issue in terms of getting dressed and getting socks on, or even washing your feet, okay? So there's some special equipment that we're gonna recommend you use for a little while until you're able to bend forward. So this is what we call our hip kit, and it has all the equipment that you'll need in order to do your ADLs, or your activities of daily living. This can be purchased downstairs at the pharmacy, and we'll recommend you get that before going home. Just make sure you don't get it before your surgery, because you never really know what you might need, okay? So now, Miss Leonard, we're gonna stand up, and we'll take a walk over to the sink, okay? Make sure you push through the bed, grab for the walker. Very good. Good morning, Mr. Gaskell.
Good morning.
How are you feeling?
I'm okay.
Good. My name is Gina. I'm one of the occupational therapists here at the hospital.
Hi, Gina.
Nice to meet you. I'm not sure if you're familiar with what occupational therapy is, but we focus on what we call ADLs, or your activities of daily living. All the basic routine type stuff like bathing and dressing and getting into the bathroom. All that stuff that you were likely doing by yourself before your surgery. Now you may find after the knee replacement surgery that things are a little bit different, but only temporary. So we're going to take a look at what you might need help with and go from there, okay?
Okay.
All right. So we're going to start by having you sit up at the side of the bed over here. You're going to bring your head up a little bit. Good. So I'll help with the right knee, and you'll help the left leg come to the side of the bed, okay? Good job. Very good. We'll let that leg just rest on the floor there. Perfect. How do you feel?
Okay.
Pretty good? All right. Are you able to reach down and get that sock off? Just your blue sock?
Ooh.
It's a little tough, huh?
Yeah.
So if you do have trouble with those kind of things, like getting your socks on and off, or your shoes on and off, or even washing the bottom of your legs, we have some equipment that we can show you that might be beneficial, okay? We have things like a longer sponge for you to be able to reach down there. This is a grabber, which can help get your underpants or your pants back on, or obviously pick things up off the floor. And we also have a long shoehorn. Now those items can be purchased downstairs in the pharmacy or at places like Walmart and Walgreens if you end up needing them. Just make sure before your knee replacement surgery you don't get them on your own so that you can see exactly what you might need. Does that make sense?
Yes, ma'am.
Okay, sounds good. So now we're gonna get up on our feet, take a walk to the sink, okay? We'll use a walker. I want you to try and push from the bed when you go to stand up, okay? And then reach for the walker. Good job.